Hello, good afternoon, everybody. I'm really pleased to have you here listening to our meeting with Dr. Rowland Illing from AWS. So I'm Alejandro Varetoni, Business Development Manager of Dedalus for the Digital Imaging IT Business Unit for Latin America and other regions. So I'm very glad to have you here, Rowland. Let's introduce yourself to the people.
Thank you very much, Alejandro. It's a pleasure to join you today to discuss digital health. It's a hugely exciting topic. I'm the Director and Chief Medical Officer for AWS, that's Amazon Web Services, Public Sector Health International. So I'm responsible for healthcare outside the US for AWS. And I'm a physician by background, so I'm actually an academic interventional radiologist by training. So I have a deep interest in digital health and an absolute drive to make sure that it's done effectively, because I feel the need as an end user, as a doctor, to make sure that we deliver the right solutions to care providers at the time of need.
That's really great to hear. Actually, in my background, I'm an electronic engineer. I've been working in let's say, imaging technology for 20 plus years now in the marketplace. And today we are facing really exciting moments, right? Because technology is impacting strongly the way that medical imaging and radiology in particular is being managed by institutions, by hospitals, by network of healthcare, in the region and also worldwide. So we are here because and just for the people to know why we are having this conversation, Dedalus launched actually 1 year ago in the Radiology Congress of Chile for the first time in Latin America, our cloud-native PACS solution named PACS on Web, right? And now we are a year older, right? And we have we collected a lot of experience in this initial moments of introducing into the market a completely disrupting and innovative technology. And we faced a lot of things. And I would like to talk with you and to discuss the challenges that, in your view, the market is facing. For example, just to trigger, let's say, the first shot, there's one topic that concerns a lot of customers when we start talking about cloud solution into the radiology marketplace, which is data migration. We came from a world where we are in a very mature market with most of the hospital already managing medical imaging in different PACS solutions, mostly on premise. So the first step to moving into the cloud is data migration and how to manage these large data volumes, right, in our links and how the cloud infrastructure can impact this, and which is your view on that?
I think that's a really interesting question, and often that's a starting point of just how do you even begin to start moving this massive amounts of data, often terabytes, often petabytes of data, off on-premises infrastructure into the cloud. And I think before we go there to that kind of tactical discussion, I think the way I'd frame it is to say there's been we're in the middle of a massive transformation of the way that healthcare data is managed. And I think that in the last 2 or 3 years, end users have really begun to realize that they can no longer manage this amount of data infrastructure on their own premises. The amount of healthcare data is going up exponentially. Trying to predict the amount of data requirement they will need on premises in the next 5 years is almost impossible because Absolutely. It's exponential. And so they're in this horrible position where they've got a lot of data on premises, but they can't predict their future needs. So what do they do? And so what we're seeing very innovative ways of dealing with this. We're seeing migration of new workloads. So we say, let's keep the stuff we've got on premises. Maybe you start by doing disaster recovery and backup. Let's just put our backup copy in the cloud. And how you do that, well, there are different ways to do that. Either you can connect it directly to the cloud data centers using something like Direct Connect, big fiber optic channels, you can have really fast data upload. You can put things in devices, actually portable drives, essentially, called the Snow family, and move those drives and plug them straight into the cloud infrastructure. But that is only part of the story. Just taking some of the migration workload and doing some of the backup is part of the story. What we're seeing now, which is the real transformation, is running these workloads in production. So not only having your working copy on premises and a backup in the cloud, actually moving everything to cloud. And what our end users are finding is they can just have a single definitive copy of any data. And instead of sending that image to somewhere and making a duplication, keeping that definitive copy and allowing access to it by end users. And that's a really interesting change from data movement, data transmission, to once it's moved, you don't need to move it again. And I think that's a real bit of transformation. So on one side, we have mechanisms to migrate this data into the cloud, but when it's there, you don't want to move it again. It just stays there and you can always add to it, but it makes it much easier to handle going forward.
And now that I'm fully agree with you. And actually that trigger another idea from my view, which is having all the information in production into the cloud, allow us and allow the customers and the institution not only to manage the data in a much more efficient ways, let's say from the cost perspective, because basically you are using or paying for what you really need instead of having idle capacity for the next 5 years, right? Storage, but also open a door for a new kind of opportunity, which is sharing information. Something that I'm seeing is that today, healthcare data in general, and also imaging in particular, is no longer needed to be closed, right? To be protected in a single place, but to be shared between the different stakeholders, because today we have different environments where institutions needs to share the data in a secure way with other stakeholders. Which is your view on that?
Absolutely. The need for secure data sharing is absolutely paramount, especially with global threats like the pandemic, where data sharing across networks is absolutely essential. And if data is locked into silos that are inaccessible from the outside, first of all, that data is not free to be used. And also, we're seeing a move to cloud triggered because of the security risk of on-premises data centers, because organizations which manage their own data centers are responsible for all of the hardware updates, the patching, the security of the physical infrastructure. And we're finding a move away. So organizations no longer want to manage big data centers. That's not their core business. Their core business is delivering care to their patients. And to outsource that back office, to have the software as a service. And so again, Dedalus has got a great, offering of that imaging platform as a service, so that end users don't need to worry about all the infrastructure. And Dedalus can rely on those layers of security put in place around the cloud. So again, Dedalus can get on with building the best applications for the end users, but all of the access management controls, the threat detection, the infrastructure protection, incidents response, which is ubiquitous. It doesn't matter whether it's imaging data or any other kind of data. That's just core data management in the cloud that AWS is very good at, and that's our wheelhouse. And organizations should allow us to manage their data on their behalf, but of course, understanding that we don't have access to that data. The
Absolutely.
data is managed on their behalf by you. So Dedalus is the trusted advisor to the healthcare customer, and the healthcare providers manage the data, provide access controls, and we're just the pipes and the channels where this data flows.
That's great, and I absolutely agree with that. all over the world, and especially in Latin America, security breaches, cyber attacks, and so on. And unfortunately, very often seen in the healthcare environment. Perhaps in the last years was not the case, but today healthcare is in the top of more attacked, I will say, or vulnerable places where we are suffering this type of security issues. So having proper mechanisms to guarantee the institutions that the data is safe, right? As you said, is of paramount importance.
I'd also add there are two different elements to this as well. There's one which is the physical infrastructure. So AWS are actually building their own silicon with encryption built into the chips. So there's a whole new generation of silicon being developed, which will make it very secure indeed. Then there's the piece about actually architecting the solutions. And so so AWS can support organizations such as Dedalus to architect their solutions with a very, very high level of security. That's one of our key pillars. And to make sure that the end customers have got all of their information backed up and architected appropriately. So, it's impossible to say that security events will never happen, because there are human elements to security as well. And so we need to make sure that if human elements happen that compromise security, everything is backed up and secured. And the exquisite thing about the cloud is that it's really traceable. It leaves an audit trail that is immutable. So if something happens, if there is some problem, in the way that on premises you can't trace back. If someone accesses and puts a USB stick into a hard drive and downloads something, you will never know. With the cloud, it's absolutely exquisitely traceable, and that's really important when you're thinking about governance.
That's true, and also, let's say, we are in the position to provide this kind of peace of mind, right, to the customer, right, in several senses. There's another concern related with this on-prem to the cloud migration, which is the communication or the telecommunication networks in Latin America, right? We do not have the kind of high bandwidth, low latency links and so on. So we need to face also some challenges, especially when you go outside the capital cities or the major places. In order to really provide a good quality services to the users, you need to guarantee from the applications and from the infrastructure perspective some mechanisms to, let's say, improve or at least to minimize the impact on the links. Which is your view on this?
Very, very important. And again, I think there are two elements to it. I think the first element is the connections themselves. And again, we're very fortunate to be working with some of the biggest telecommunications groups around the world, including large telecom providers across Latin America who are our partners. And we need to make sure that the connections, so AWS will provide connections between data centers, and we can provide direct connections into healthcare organizations, but more commonly they're done through partners, through telco organizations. And that's where a three-way partnership happens. So that's with AWS and with Dedalus and with a telco partner to make sure that connectivity is there. And we see that today. So we already support some large academic teaching hospitals, for instance, in Brazil. So we support Hospital Sierra Lebanese and Albert Einstein. And Hospital Sierra Lebanese is fascinating. They actually have a intensive care system. So they're actually able to connect into intensive care units, into remote hospitals within the Amazon jungle, and create near real-time communication with those centers. Wow. Where health providers who may not be as expert as the center are able to communicate with those experts in order to deliver care. And so we've demonstrated that we're able to create these low latency, high bandwidth environments, even in environments that are seemingly challenging. Then the second part is around the applications themselves. And this is where Dedalus comes into its own, because you need to develop applications that themselves have low latency and are able to use all of those elements of the cloud and the cloud native solutions or cloud native services to really make the applications go quick. And so we're finding these applications which are built specifically to be used on cloud normally outperform those applications which are traditionally run on premises and then are just being run on the cloud because that's a thing to do. So this movement to cloud native services and solutions is absolutely critical. And I think that's where Dedalus is really making a difference, is that vision to be cloud native is really exciting. And that's why we're coming out with some great products.
That's absolutely true. And thanks for the hints, because that's one of the pillars of our own messaging. You know, it's not the same a cloud native solution than an on-prem solution hosted in the cloud or in an external data center. That's a huge difference. Now, changing a bit the gears, because actually our audience will be most clinical than technical, but I'm a bit, let's say, excited about all the technology. But let's talk a bit about how this technology is impacting the radiology practice, right? And one of the very strong trends that we are seeing in Latin America and in Chile in particular is the teleradiology trend. You know, new large teleradiology groups starting to provide services, and not only let's say massive reading centers and so on, but also high quality, high complexity private hospital that start to provide teleradiology services in countryside hospitals and so on. It's a very interesting, let's say, movement that is impacting radiology today. Which is your view about that?
I think teleradiology itself is an amazing advance in terms of democratization of access to expert reporting. And I think we see that more and more. And as a radiologist, I want to be able to use a single interface for complex imaging reporting as well as straightforward chest X-ray reporting. And it's got to be fit for purpose in tertiary or quaternary referral centers, very high level academic teaching hospitals, as well as in the community. And again, with some of these cloud native services, you're able to bring out these solutions into all comers because they're downloadable and they've got basically a web interface. And I think that's the exciting thing, because you can scale up your network and also then tap into subspecialty expertise. And so we're seeing teleradiology groups set up across the Americas, Latin America, Europe, and Asia Pacific, where you have a follow the sun model. You know, you can have teleradiologists around the world who are always working during the day, even if they're working out of hours in the country of origin, and be able to bring subspecialty expertise, either neurology or cardiac reporting, because you're able to aggregate scans across the network. And so again, I think it'll serve patients really well because they'll have an awake radiologist working in their daytime, and they'll ideally be a specialist in that area of study. And then, of course, I'm sure we'll go on to it, the layer of artificial intelligence which is coming, which is going to be layered on over the top. And I think, again, teleradiology lends itself, because of the scale of the data being used, as a really important testing ground for artificial intelligence in the future.
Yeah, and before moving into the AI, which is fascinating, we'll cover as well. What I've seen in the last months working on this teleradiology project is that there's some specific, let's say, challenges we need to tackle. For example, we have teleradiology vendors that needs to cover or to provide services to a wider range of customer or hospitals type, right? You know, we have, as you mentioned, large university hospitals that needs a radiologist to have a highly specialized reading, and also you have countrysides hospitals without radiologists at all, and needs to that requires reading. And from the user's perspective, the radiologists, you know, which are currently providing those services, normally what happened is that they have to adapt themselves to read for the different, let's say, environments, which is it's a nightmare for them, because they have to learn how to use different software, different tools, and logged in different solutions. So having a centralized multi-tenancy platform where the radiologist has a single point of access, it's crucial. And also for the teleradiology vendors, the companies itself, they have the challenge to hire and retain radiologists, right? So they have to provide them with good working conditions or with good tools for them to be engaged, let's say, into their job. It's not an easy task, but as you know, in Latin America, there's a lack of radiologists. There's not enough radiologists to cover all the needs, right? So having good, let's say, working environment is crucial.
Yeah, and as a radiologist, I know that any more clicks than one click is too many clicks. And so
that's good.
And so minimize the number of clicks and certainly minimize the number of tools that you have to use. And if the more configurable but familiar the interface is, the better. So if you can make it highly configurable, very straightforward, user-friendly interface, it just makes the radiologists' lives much easier. And as you say, there's a big problem with burnout. There's a big problem with lack of staffing. And all of these things can be made easier by better tools. But workflow is also very important as well. And so having the solution which can embed workflow, smart workflows for specific imaging types, and make sure that the right radiologist has the right image at the right time, again, goes a long way to optimizing throughput and efficiency of the organization. Because some teleradiology networks now, are getting millions of studies across them every year, and to manage that volume of data is a very complex task. And so the solution has got to not only be good for the clinician, it's also got to be good for the administration. And both of those elements are equally important, in fact.
Yeah, absolutely. And then there is where AI perhaps comes in, right? Because now we are seeing artificial intelligence algorithm impacting the way that these workflows are managed. The workloads are assigned, or the reading tasks are assigned based on different criteria, like I don't know, image triage or subspecialties assignment and so on. So artificial intelligence, it's impacting not only the way that the images are processed, but also how the workloads for the radiologists are improved, that workflows are optimized, I will say. Which is your view?
Yeah.
Do you agree with that?
Yeah, absolutely. I think to put into context as well, AWS is very lucky to be a good platform to build AI solutions. So we have hundreds of thousands of users already building AI solutions on the cloud today. And we've had, over 90% of deep learning on the cloud happens on AWS. So just to put it into perspective, the scale of computing that takes place is enormous. And we see many radiology was really the first mover in AI in healthcare. And so ever since 2015, 16, we've been seeing the first applications coming out. And now we're seeing hundreds of different applications, as you say, either for workflow, for a triage, and for now image interpretation itself. And I think it's hugely exciting because, again, if the AI can pre-read images and detect abnormalities and then bring them up the workflow, for instance, AI Doc is a good example of that, or Analyse AI out of Asia Pacific. There are some really well-tested, FDA-approved, CE-marked, local regulations approved AI that now can be in workflows today, making an impact. And again, so an interesting case was actually during the pandemic, where one of the big Brazilian hospitals set up a telemedicine or teleradiology platform and had AI built into the platform. And so hospitals around Brazil could send CT scans of the chest, so cross-sectional imaging of patients with suspected COVID infection, two different AI systems would interpret the CT scan, and then a report would be sent back to the end hospital within a matter of seconds, giving a likelihood of infection with COVID. And so here you see the ability to combine teleradiology with AI to really, again, as I say, democratize access to best-in-class care, because these centers didn't have expert chest radiologists, but they were able to tap into an AI, not anywhere near their local hospital. It wasn't, you didn't need to go to the hospital and deploy the AI on site. You could deploy the AI in the cloud, run the AI on those images, and then push the result back to the end user. And so here we see the massive scale that cloud can bring through partners to end users.
Absolutely, and that triggered me another let's say question, which is or idea, which is one of the challenges that I see on the adoption of AI into radiology, because as you mentioned, AI is being present in radiology for years now, but if you see the adoption is very slow, very low. And from my view, this is because we need to embed the AI into the normal workflows of the radiologists. You know, today we are kind of using the radiologists as a connecting point, right? So they have to trigger the algorithm number 1 or number 2. And from my view, this will change strongly when we can embed and integrate all the AI in the standard workflow. So the radiologist or the clinician not even know that some exams are being processed by an AI algorithm, but they see also the output. So in that sense, this concept of integrated platform we are, let's say, developing in the market, it's important because you can, let's say, select which algorithms you want to, let's say, process such image and then see the results without having these extra clicks, which are so annoying for the radiologist, right? So that's a challenge, how to bring, right, the technology into the standard day in, day out work of the radiologist.
I totally agree. I think there are three elements, in fact. I think there is an integration to the workflow, as you say. And again, as you say, one click is too many, or 2 clicks are too many. And so how do you bring them all together? Because AI, up until now, has really been, lots of different AIs have been built independently. And so how you bring those together, and there have been platforms that have been set up as well that can aggregate, but then they still are an additional piece to the platform. So as you say, I think having a seamless platform where AI can be accessed at the click of a mouse, absolutely the way forward. I think the second element is actually payment, and it's been a challenge to say, how do hospitals and healthcare systems pay for AI?
Yeah.
Because if you think in the future, if you pay 1 cent on every dollar for an AI, and in the future there will be 100 AIs, suddenly there's nothing, your money runs out. And so how you can integrate all of these AIs, how can you choose the best in class AI for your use case? How can you tap into them at the point of need and then turn them off when you don't need them? There's a whole piece around there that is still being worked out by many health systems. And there are some countries which are quite progressive. So Germany, for instance, have released a system where digital therapeutics can now be paid for. And we know that there are some AIs in the US, so around breast imaging, that will be paid for as well. So I think there is a piece around policy around individual countries about how that will regulate the speed of adoption, because again, it'll incentivize their use if these can be accelerated. And the third thing is around trust, and it's about really ensuring that the care providers and the end users understand the processes by which the AI have been developed. They trust the platform which is hosting those services. And we're very focused on appropriate use and governance of AI and putting a human in the loop and making sure that radiologists are always present, and that there's a quality assurance piece in place over the top, and to make sure that there are no surprises.
Yeah, absolutely agree. That's a very nice and clever approach, I would say. Another topic that you just lateral mentioned, which is again important in this new trend or the new way that radiology is transforming today, is related with how to involve clinician or referral physician and patients into the standard workflow. Normally in the past, radiologists were locked in the blue room in a basement, right? And now the reality and the technology is allowing to be more connected, more in touch between clinician, patients, and radiologists. And how can we, from our perspective, right, from the technology perspective, how can we facilitate that interaction between these three stakeholders?
Again, fascinating. As a radiologist, I have lived through this move from radiologists just being in a dark room reporting to being much more patient-facing and also other clinician-facing, because there is an explanatory role that radiologists play in making sure that the findings are transmitted appropriately. And so, again, I think AI will have a really impactful role here, because AI should make it faster for radiologists to do their jobs. Hopefully it will AI will be there to flag up findings, alert radiologists when follow-up is needed. And then also it's the associated technology that goes with just the image viewer. So again, you want to be part of an ecosystem of solutions that can also embed things like telemedicine. You want to be able to work within a radiology viewer, but then be able to turn on a telemedicine platform and have a face-to-face video consultation with the referrer and say, hey, what do you think about this? Do you want to both log into the same instance and you can look at things at the same time in real time? Allowing patients to access their data through portals and allow them to communicate directly with physicians. Again, there's a lot of very associated technology just to the radiology platform around patient engagement, what we call the digital front door, and allow patients and clinicians to come together in a meaningful way to communicate, because it's around this communication that's absolutely essential. And here we have as well, around talking about AI, the next generation of AI around foundation models. And there's a lot of hype at the moment about generative AI and foundation models and what does that mean. We're working with a lot of different foundation model providers. So we've got a service on our platform called Bedrock, and it can host different types of foundation model. And one of the use cases for these foundation models is actually interpreting radiology reports for patients. And so you'd actually get the generative AI saying, take this radiology report and put it into a format that can be understood by a layperson. And it's a really interesting exercise. So you can have, ways that patients can access their information made easier again by technology, but it will certainly never replace the radiologist.
Wow, that's amazing, because yes, as you said, normally the reports are done, for the clinicians or for the referral physicians, not always for the patients. And today patients are much more empowered. They want to be part of the process and wants to understand what is happening to them. You changing again the gears, and perhaps the last topic to cover, or at least the last one that I bring, is you mentioned at the beginning of our conversation the democratization, right, of the access, the technology for the market or for the society itself. Something that I'm seeing now is how to cover this small and medium segment. I will say from the marketing perspective is how to reach small clinics, small hospital in rural areas, where they do not have normally the budgets, not the skills or the know-how to really take advantage of the advances of the technology. Because normally when we think in implementing new solution or innovate, let's say we think in Albert Einstein in Brazil or Clínica Alemana de Santiago or these large hospitals. But how we can impact with this technology the basis of the pyramid, right? The small and medium hospital clinics and even individuals, which are sometimes very, let's say, for them it's very difficult to take advantage of the advances in technology. How's your view on this?
I think there are some key things that we as a technology cloud provider and you as the solution provider and the trusted interface for these small and medium-sized organizations, we have a role to play, because we have to focus on those end users and make sure that the solutions they use, first of all, best in class, and so that they actually provide all of the needs for the end user, but that they're cost effective. And so that price point that they have to be able to use, they may not need all of the various applications. So to have a highly modular and configurable solution, and so they only use the technology that they require and only access it and pay for it when they use it, like an access on demand system, is absolutely essential. Because to make it price performant is the way that you're going to scale things more broadly. Thirdly, it's got to be very straightforward to deploy and to train. And so the interface has got to be very intuitive. Because again, when there are thousands and thousands of small hospitals in quite remote areas, having people to go on premises to train people to plug wires in is almost impossible. It has to be, we have to be able to train remotely. It has to be very intuitive to use, and it has to be scalable more broadly without requiring an army of people to go and do it. And I think if you can have all of those elements, if it does everything it needs to do, but not anymore, if it's got the right user interface, if it's price performant, I think, and available to be deployed and scale and be trained remotely, all of those elements will go to really democratizing access. And I think if we can bring those things together between us, it'll really serve those end users. And of course, we should always hear those end hospitals and ask them what they need. But the commonality, I think we'll be able to address.
Yeah, I fully agree, and that's a reality of our region, where budgets are small, people or institutions are under a lot of pressure for cost control and so on. So yeah, cost effectiveness it's really crucial, have an access and user-friendly solution. I fully agree. Well, Dr. Rowland, I think that we are just finishing our conversation. I'm really glad to have this conversation with you, to see that we have a synergy, right, between the industry, the solutions, and the technology you provide. So I'm really glad to have you here. I hope that everybody that is looking to us enjoy the conversation. We are open to receive feedback, comments, or questions afterwards. So really, again, thank you for your time, and let's hope that we can continue impacting, right, the market together.